Did you know a single tick bite could make you allergic to meat and even some medications? In this video, we're diving into the surprising condition called alpha-gal syndrome and what you need to know to protect yourself.
And this is a syndrome not caused by a pathogen. Instead, it is caused by the carbohydrate galactose alpha-1,3 galactose, or for short, alpha-gal, which is carried in the tick saliva. Humans do not make alpha-gal carbohydrate. Other non-primate mammals do. So the human immune system can create anti-alpha-gal immunoglobulin E antibodies to this alpha-gal sugar after eating mammalian meat, like beef, pork, or lamb, which results in an allergic reaction. The reaction to the mammalian meat or products, as we'll see, the list can be long, can occur weeks to months after the tick bite. So first, you might acquire this reaction, but it's not playing out yet because you have not had enough to create that reaction if eating mammalian meat. And so sometimes it takes weeks to months to show up as that allergic reaction in a person. The onset of symptoms is 3 to 8 hours after eating a mammalian product, and the known carriers are the Lone Star tick in the US, Amblyomma caginense in Central America, and the Asian longhorned tick in Asia, but not in the US. There are a small percentage of people bitten by these ticks that will develop the alpha-gal syndrome. Not everybody does. And what we see is that the higher number of tick bites equals a higher chance of getting this alpha-gal reaction. Alpha-gal is the #1 trigger of anaphylaxis in adults in the United States. Here we'll take a look at common mammal-containing triggers to the allergic reaction. Now, usually we're thinking about meat, like I mentioned, pork or lamb, but it could be the organ meats, it could be the blood of the animals. Also, some people are affected by dairy, gelatin, fat, lard, suey, foods that contain mammalian byproducts. Carrageenan is interesting. It's not from a mammal, but it contains the alpha-gal epitope from red algae, which is a seaweed. Also, flounder eggs can trigger this reaction, natural flavorings, and then drugs, medical products, personal care or household products with mammalian ingredients can also trigger this response. So you have to really look closely at ingredients. Now, there is a blood test that you can take to diagnose this syndrome, which is really, really helpful. It's called the alpha-gal IgE blood test. And an invaluable resource is alphagalinformation.org. Thank you so much, Scott Cummins in North Carolina, who's done incredible research and has shared so much knowledge with the community on this syndrome. So you can find lots of information there. I highly encourage you to check it out. Here is the geographic distribution of the syndrome in the United States from 2017 to 2020. So you'll see the gray area is where no testing was performed. The white area is where no suspected cases are. And then the light blue moving toward darker blue has an increasing number of suspected cases. So we'll see some hot spots down in this mid-east southern area, and also upper north central area of the United States. And then here is a geographic distribution of the ticks that have been detected to be causative of alpha-gal. So we talked about the United States and Central America. In South America, here is the Amblyomma sculptatum, Ixodes ricinus in Europe, Amblyomma variegatum in Africa. And then over in Asia, we see the Asian longhorn tick, as we mentioned, and then a different Ixodes nipponensis. And then going to Australia, we see Ixodes polycyclus. Now let's look at the signs and symptoms of alpha-gal syndrome. So Sometime after a tick bite, which someone may or may not have noticed, they will have a meal, and it will include some kind of mammalian meat. Or they'll have some other product, whether it's on their skin or they ingest it, that has mammalian byproducts in it. So after that trigger, we'll see that 90% of people have skin symptoms, like hives or flushing. The typical first symptoms are itching of the palms and soles of the feet. They may see a rash, they may see swelling, or they may not. Then we can also see itching and swelling in the mouth, lips, face, tongue, and throat, or even throat closing. And so anaphylaxis is seen in 60% of people, which can be life-threatening. Some people get cardiac symptoms, so 30 to 40% of people might get low blood pressure, lightheadedness, dizziness, a rapid or a weak pulse, and fainting. We can also see respiratory symptoms like shortness of breath, wheezing, chest tightness, a cough or hoarseness, and trouble breathing. Then 20% of people will have GI symptoms alone. These may include abdominal pain, diarrhea, nausea, vomiting, and heartburn. People can also see runny nose or sneezing and headaches. Now remember, a tick bite may not always be remembered weeks to months prior to the onset of these symptoms. So it's certainly important to ask about that history, to note whether you had a tick bite, but sometimes it may not be known. So if we're thinking about allergic reactions, we need to also think about alpha-gal syndrome in that differential list. Alpha-gal syndrome treatment. Currently, there is no FDA-approved treatment, and the allergy may resolve over time, but this requires symptom management. Use antihistamines for allergic reactions, and the biggest treatment principle is diet change. So we need to avoid the alpha-gal containing products like mammalian meat and products that come from mammals. This may include certain medications and even skin products. There is quite a range of severity of reaction to items on the avoidance list. So it's very individualized. Unfortunately, it takes a lot of trial and error for some people. And over time, it unfolds which products or meats, etc., really set off that allergic reaction for somebody and what they must absolutely avoid. So let's take a look at a really summarized version of the alpha-gal syndrome product avoidance. But this is pretty compact and comprehensive. So mammalian meats include beef, pork, lamb, bison, venison, goat, horse, rabbit, squirrel, kangaroo, antelope, buffalo, camel, guinea pigs, bats, and whales. Now we have mammalian fat like lard, tallow, and suey, internal organs of mammals, then products that come from mammals like bones, you've got gelatin, collagen, broth, bouillon, stock, gravy, and blood pudding. Some people must even avoid dairy products, natural flavors, and carrageenan. Medications and medical products that contain alpha-gal can also be an issue. There's cetuximab, monoclonal antibodies, pancreatic enzymes, hormone replacement therapy, stearic acid, glycerin, and vaccines that use gelatin on that list. Finally, skin products containing mammal-derived ingredients such as gelatin and lanolin might need to be avoided. So for a really exhaustive list, there's this excellent website, alphagalinformation.org. Take a look there and at the rest of the website because they have a lot of really helpful information. Now let's take a look at a highly successful acupuncture protocol. This was really exciting to learn about. So there's a study from 2021. It was a retrospective review of 137 patients, and they used what's called the Soliman Auricular Allergy Treatment, or SAAT. And there are practitioners out there that are trained that you can find to do this. So basically, to summarize, they take a tiny needle and place that in the ear, and they keep it in place for 3 weeks. This is safe, there are no side effects, and 96% of patients had a remission of symptoms, and that was sustained for 9 months or longer, even with some patients having reintroduced foods that were otherwise causing allergic reactions before this intervention. So this was a really incredible study and really promising. So if you are struggling, or if you have a patient who is struggling with alpha-gal syndrome, I'd highly suggest, in addition to trying to figure out those food allergies or the products, or what are the triggers for these allergic reactions with alpha-gal in them, which can be really hard sometimes, look up a professional who does the SAAT acupuncture protocol.